the seven-eyed model of supervision. What is a seven-eyed model?
Well, that's really interesting. You should ask, Ken. In the 70s, when counselling was a cottage industry, there wasn't any concept of supervision as such. They used to have what they used to call co-counselling, where you would just visit a colleague and talk about your practice. And then a bit of a groundbreaking book came out in 1985 called On Learning from the Patient by Patrick Casement. He was a psychoanalyst and wrote the first book on supervision and what we learn from our clients and our practice. But not longer after that, in fact, in the same year, Peter Hawkins and Robin Showat wrote a book called The Helping Professions, and they brought a model of supervision, and that model of supervision is still used today, and it's called the seven-eyed model. There are different models of supervision, but predominantly, if you're in the UK, most of the supervisors would use a seven-eyed model. It's 7 different ways of looking at the client presentation and related relationships. So if you think you go to maybe a museum and you see a sculpture, people walk around it and look from different perspectives. This is exactly what the seven-eyed model does in counselling. It asks the supervisee to look at their practice in different ways to get a real sense of what's going on.
Yes, and of course, what we're talking about now is clinical supervision. The 7-eye model is not exclusively used by counsellors and psychotherapists. I think we start this off just by defining what clinical supervision is and what is the difference between managerial supervision and clinical supervision, Rory. So I'll kick us off, of course, saying that managerial supervision, you would expect if you're working in an agency that you're going to have a line manager. They're going to want to make sure that you're okay in your job, that you're safe in the building. They may have documentation that they provide for you, and there's an element of you maybe checking in with them if you've got a challenge, but it's very different to clinical supervision. What would you say is the biggest differentiator so we can see them as completely different?
One's about the business or the organisation, and the other's about the client. If you're having managerial supervision, it's usually the HR department. It's looking at performance, it's looking at holidays, it's looking at career development. It could be looking at complaints or underperformance. Clinical supervision is solely focused on the client. Ideally, it should be external of the organisation. Why is that? Because in supervision, you should be able to bring the entirety of your practice. That includes, in some cases, critiquing the organisation you're working with and getting a sense of how you might speak to power. I think that's very liberating to say to someone without fear of losing your job, I just think they've got it wrong. And I think this is what they could do better. It allowed me to separate work from practice and put, crucially, the client first.
Yes. I love how you've outlined that. From your very first placement hour through all of your practice as a counsellor, it is always your practice. From that very first minute you see your first placement client till the time you say, okay, that's it for me. You will have different managerial supervisors within different agencies, and you may even have different clinical supervisors along the way. If you leave an agency, you can still maybe keep the same supervisor if they are still serving you. One of the major differences is that if you are a counsellor going in for clinical supervision, you're going to be working with a fellow counsellor. They will have done a further qualification to become a clinical supervisor, whereas a managerial supervisor may not even be a fellow counsellor. It could be somebody from HR. It could be just a manager over a department. And as you said, Rory, the big differentiator here is it's the person you will see and take your client work to in service of your clients, but also in a way there for you as well, which is personal. It helps us show up better for our clients. And there's a question often of how much supervision I need. Here in the UK, you would see your supervisor for 1.5 hours for every 12 hours of client work you do, or once a month, whichever comes first. You're going to be keeping records for going to see your supervisor, and your supervisor may even keep a record that you were there. And now we're going to go into the three main areas of supervision before we delve into that seven-eyed model that we promised at the beginning, and that's formative, normative, and restorative. And I wonder if you can explain how they balance one another out.
Yes, a part of being a supervisor is working out where on the path the supervisee is. And what I mean by that is, are they a experienced practitioner with many years of practice and a lot of CPD, or are they maybe a student? And depending on that, I may then start a position by looking at the supervisee. Let's say we get a student. I may say they need more formative information. Formative is information. There is an element of direction. It's not non-directive. Supervision is lightly directive. So it may be that you're filling in the gaps, and that can be sharing reflections from your own practice about client presentations, giving practical information, like if their notes are asked for, or if they need to sign up with data protection. So that's the formative side. Then you have the normative side, and that's when your supervisee comes in, and they may come in and go, I've just let this client down. I just don't know what I can do to help this client. That's restorative. That restorative side is trying to bring back the supervisee to give them support when they're struggling with clients. So formative is information. Restorative is supporting the supervisee if they're struggling with clients or they may feel uncertain of what they do. And then we have normative, which is the sort of managerial side of things. It might be about trying to work out where their competence lies in things like assessment, signing up for GDPR, making sure that they've got the paperwork and their insurances.
Yeah, the formative is growth-based, as you've mentioned, sharing information. Normative is monitoring-based. So the supervisee might present to the supervisor with something, and the supervisor may say, well, what does your ethical framework say about that? And they're almost monitoring what you're doing and getting you as the counsellor to monitor your own practice as well. So they challenge you on monitoring, and of restorative, you've beautifully described as holding you as a counsellor. And I think what's really important to say here is restorative is not therapy. You may come in and say, I'm burnt out, I'm seeing too many clients, it's starting to trigger stuff from my own life. Of course, restorative, your supervisor is going to hold you there, but your supervisor may also then say, you know what, maybe it's time for you to step into your own personal therapy. It's not unusual to step into therapy. It's a strength, not a weakness as a counsellor. So we're now going to move on to the seven-eyed model of supervision that you beautifully introduced in the beginning. And I liked how you said it's like going to an art gallery. When you go into supervision, it's almost like they're standing one side and looking and seeing one aspect, and then walking around and seeing a different aspect of you, your client, and your practice. And we start off, they're called focuses, and there's seven of them. I'm going to run through the seven quickly. The focus that the supervisor will have is, number one, they're going to be asking you around your client, who the client is, how they show up. Number two, the supervisee's intentions and interventions. How are you working with this client? What are you doing? What's your modality? What have you tried? The client-supervisee relationship. Who is this client to you as the counsellor when you're in practice? What does that relationship look and feel like? Your own experiences as a counsellor. So in other words, the supervisee's own experiences. Then the supervisor-supervisee relationship. That's an important part as well. Your supervisor's own reflections, what your supervisor may think, feel, and share, and then wider context, what's going on outside of that relationship. So that's a very quick whistle-stop tour, Rory. Expand on client for me, the focus on the client.
Yes, so I alluded to an art gallery and walking around looking at a sculpture or some piece of art. And you have to start off with the client first and foremost, because if we don't have the client in focus, you don't explain to your supervisor who this client is, how they present, a little bit about them, we can lose focus on who the person is, because we're dealing with a real person. It speaks to respecting the client. There's a real person being discussed here, which is why it's usually asked first, tell me about this client. Then supervisee's interventions. That could be how you're working with the clients. That could be things like the direction the client's going in terms of what they want to look at and how you're supporting that. If you work in a different modality, if you're a transactional analysis therapist, it might be you're looking at scripts or ego states. If you're a CBT therapist, it might be about homework. What are you bringing to it? And then the third one is the client-supervisee relationship. All therapy, and the research is never wrong on this, the quality of the therapeutic relationship is one of the big arbitrators of successful therapy for clients. By asking, how are you getting on with this client? And it might be you get someone say, actually, I don't like this client. There's something about this client. So you would say, okay, tell me what is it? And as a supervisor, you would look at transference and you said, does this person remind you of anybody? And you go, now you mention it, remind me of my old boyfriend. And then you have to say, actually, that's not your boyfriend. It just looks like it, and work through that. Checking the quality of the relationship is really important. Then for the supervisee's own experience. And again, how does it feel to work with this client? What's going on for you? And it might very well be what's brought up has triggered stuff in the therapist, in which case it's worth investigating there. So you can see the checks and balances as we go through here. And then 5, the supervisor-supervisee relationship. All therapy and all interactions really rely on the quality of the relationship. So it's useful for a supervisor to check in and say, how are things going? How do you feel about me saying that? And trying to build an equality to reduce the power. That's what this is really about. And then number 6, supervisor's own reflections. And that can be sharing a bit of your own practice. I've heard what you said about this client, and I wonder, if this was my client, I might be inclined to go in this direction or try this or try that. And that's about sharing a bit of wisdom, a bit of clinical experience to give a different perspective to how the supervisee may be working. And then 7 is the wider context. Now, what you're asking in the wider context is, what's going on around this client? So it could be a work environment, it could be their home life, it could be where they are in the world. Remember, we do online and telephone counselling now, and that gives a sense of where the client's placed in the wider area of their lives. Very useful to get a sense of what the client's experiencing externally to what's happening in the therapy room. And that, in a nutshell, is the 7-eyed model.
Yeah, it's a really interesting model because it does it has checks and balances as it goes through. And I'll be honest, when I first went into supervision, I thought that my supervisor was just a counsellor with a lot more experience than I had, and they were now offering their wisdom to supervise. And what was actually going on behind the scenes was invisible to me until I trained as a clinical supervisor myself, and it was the moment. I could see what was actually going on. You were speaking, Rory, about earlier when you went to your supervisor and you would take in a challenge and your supervisor would say, what are you feeling around this, Rory? And that is your supervisor developing your internal supervisor. Every counsellor needs a supervisor.